First of all, Wocq and Lazarus 1985 modified the way of copying checklist WCCL by dropping some items and adding others, thus creating a 66-item self-report measure. So the way of copying questionnaire is based on the original 68-item way of copying checklist or WCC, which has the yes or no response format. Redundant and unclear items were deleted or rewarded, and several items such as prayer were added. Next, we move on to the developer. So the way of copying questionnaire was developed by Susan Wocq and Richard S. Lazarus. So the purpose of this questionnaire is to identify the thought and action an individual has used to cope with a specific stressful encounter. It is also to understand the client's coping styles by exploring and being sensitive to his or her cultural values in order to establish therapeutic alliance throughout the therapy assessment. So this is a self-report assessment. Next, we move on to the components being assessed in this assessment and the target population. So the components being assessed in the studies on 1986 based on 8-factor solution, which is confrontative coping, distancing, self-controlling, seeking social support, accepting responsibilities, escape avoidance, planful problem solving, and positive reappraisal. So the target population for this assessment is students, employees, middle-aged communities, surgical patient, oncological, psychiatric patient, and patient with fibromyalgia. Then we move on to the administration procedure. First of all, the clients were asked to think about the stressful situation during the previous week. So the client got the information about how to complete the questionnaire and they can answer the question by themselves. And the revised 66-item WCQ asks the participant to think of a stressful situation and then requires them to indicate the extent to which they use a particular coping strategy in that situation. Next, we proceed to the scoring procedure for this assessment. So the client were asked to think about a stressful situation during the previous week. So a stressful situation is meant as one that the client perceived as difficult or troubling for them, either because it caused them distress or because considerable effort is required to deal with it. So sum each of the numbers in each factor solution before and conclude the coping strategies that patient used based on the highest value of the factor solution.
My name is Fatimana and I am your occupational therapist. For today, we are going to do way of coping questionnaire to assess your thought and action when you encounter a stressful event. So this assessment contains 66 items where you have to scan each question from 0 to 3. But first, I need you to imagine any stressful event that you have encountered for the past week. Okay, so you may answer this. Okay, based on the result, you can conclude that you used to cope stress by accepting responsibilities and planning strategies to solve the problem. Okay, thank you.
Based on the result, the most higher value of the factor solution is the indicator for the type of coping strategies used by the patient. So it is based on scale 0 to 3, which is 0, not used, 1, used somewhat, 2, used quite a bit, and 3, used a great deal. So next, we move on to the psychometric properties for this assessment. So the first one is test retest reliability. So the author of the WCQ considered that the traditional test retest was inappropriate as a measure of reliability because the instrument reflects processes which is highly variable. Next is the convergent validity. So the positive correlation between avoidance, self-blame, and anxiety are consistent with R value of 0.30 P less than 0.001. And the negative correlation between WCC problem focus coping scale, constipation and anxiety scale with R value of negative 0.19 and P value less than 0.001. And the last one is convergent validity, which showed an acceptable value according to the manual, which is A equal to 0.61 to 0.79. We move on to the advantage and the disadvantage of this assessment. The advantage of the assessment, the scale is easy to administer and result in a presentation of the patient's style of coping. And there are many types of coping strategies that contained in the questionnaire that we can see the patient used in their coping strategies. For the disadvantage, the psychometric data on the WCQ is limited because several published studies are based on the previous author's version of the instrument, not being used today. Second one, from pragmatic perspective, patients complain that the checklist was too long. And the last one, way of copying questionnaire is not translated in the Malay version. So now we look at the suitability of the assessment to be used in Malaysian population. So it is suitable because the scale does not touch any sensitivity of the culture and religion, which is appropriate for the Malaysian population who have mixed races. And this assessment is still not translated in Malay version, which is hard for people who have difficulty to understand in English, and this unless they are assessed by therapy.